Hi, I'm Dr. Bonny Cumming, presenting on behalf of myself and my colleague, Dr. Jess Hoops. I also want to acknowledge the many people who have contributed to this approach over many years, from AMRRIC's founders through to all the communities that we work with. To start off with, though, I'd like to acknowledge the Waka Waka, the traditional custodians of the land where I'm speaking to you from today. I recognise their ongoing connections that run terribly deep, that are to the lands, the waters, and the skies. I'd also like to pay my respects to their elders, both past and present, as well as emerging, and I extend that respect to any Indigenous peoples who are joining us today. Now I'm going to turn off my camera so that you can appreciate the slides better. The concept of One Health acknowledges the inextricable linkages between the health of humans, animals, and the environment. Around the globe, there's growing awareness of the need for holistic, collaborative and multidisciplinary approaches to health issues that both balance and optimise health outcomes for people, animals and the environment. This has led to growing motivations for undertaking One Health research. A more holistic health mindset also recognises the importance of social and cultural determinants of health in shaping health outcomes. The World Health Organization defines the social determinants of health as the non-medical factors that shape the conditions of our daily lives. This can include socioeconomic factors such as education, employment, housing and amenities, and access to health services, as well as social and cultural norms that can have a profound influence on the overall health of human populations. In the human healthcare field, social determinants of health have been shown to have a significant impact on health inequities. Companion animals, such as cats and dogs, have a close association with people, often with a shared lifestyle and living conditions. And so, while often overlooked, the same social determinants of health that shape human health outcomes also influence the health and well-being of companion animal populations, which has implications for health across the human, animal and environmental health fields. The social determinants that drive companion animal overpopulation and the establishment of free-roaming cat and dog populations, such as socioeconomic status and access to animal health and veterinary services, also impact health outcomes and the risk of disease transmission. Together with having an expanded interface of wildlife populations, free-roaming dogs and cats provide an ideal focus for investigations around disease ecology and zoonotic disease risks. As a result, free-roaming dog and cat populations are drawing increasing interest from the research community, with many animal rescues and animal management programs fielding requests from researchers for assistance in undertaking research projects. While the outcomes of One Health research have the potential to address critical knowledge gaps and facilitate long-term health benefits for people and animals, there is also the potential for negative impacts on both the animals and the local communities. Unfortunately, in many cases, research priorities are externally motivated and provide little by way of tangible benefit to the animal owners volunteering their pets to participate in the study, nor for the local stakeholders that play a fundamental role in successful research outcomes. The impacts of colonisation and historical helicopter approaches used for global health research, where research was conducted on communities in low and middle income areas, have left scars on Indigenous people around the globe, underscoring the importance of identifying and mitigating the risks of negative research impacts. As an organisation that regularly acts as a conduit between researchers and remote Indigenous communities, we wanted to take the opportunity to discuss our approach to research collaborations that aims to maximise positive impacts for researchers, local stakeholders and participants. And so through this presentation, we hope to encourage other organisations to adopt similar approaches to research to ensure that animal management groups are acting in the best interests and as the best possible allies for the communities that we serve. AMRRIC's approach to respectful research collaborations aims to maximise positive impacts for participants and communities. And we do this by ensuring quality and respectful community engagement and local leadership, by prioritising research that reflects community needs, priorities, and provides direct and tangible benefits to communities and their local stakeholders, by integrating appropriate, effective knowledge translation for local stakeholders and community members, and by helping to build local capacity. Even with the best of intentions and regardless of long-term potential benefits of research, involvement in research places additional burden on communities and local stakeholders above and beyond their other day-to-day obligations. To increase the likelihood that research outputs have the potential to address knowledge gaps that can help to facilitate long-term and meaningful positive impact for the health of animals and people, it's imperative to ensure that research objectives are aligned with the needs and priorities of the local community and their local stakeholders. AMRRIC's research activities strive to link communities with research projects that align with local needs and reflect local priorities, with the hopes of providing the best possible outcomes for both researchers and communities. We strongly believe that evidence-based approaches to health issues that reflect the needs and priorities of the community and local stakeholders and incorporate the best available evidence from local research are crucial for developing effective plans for managing health issues at the human, animal, and environmental interface. Research that prioritises the needs, perspectives, and priorities of the people and animals affected by the research increases the likelihood that the research is effective in addressing local issues, and therefore the likelihood of implementation of research findings into local policy and practice. Community engagement is defined as the meaningful inclusion of communities and local stakeholders that are impacted by research findings throughout the research journey. Quality community engagement and local leadership prioritises the needs, perspectives, and priorities of the people and animals affected by research and increases the likelihood that the research is effective in addressing local issues. Local stakeholders and community members have valuable knowledge and insight that can help to enhance the research process, and community engagement is widely acknowledged as a key factor in improving the way research is designed, interpreted, and applied in real-life contexts. Community consultation is further strengthened by incorporating the perspectives and lived experiences of local stakeholders and community members, increasing the likelihood of supporting the best possible outcomes for the health of people, animals, and local ecosystems. AMRRIC prioritises research projects that ensure respectful and quality engagement with communities and local stakeholders, ensuring wherever possible that community representatives are full partners in the planning, development, implementation, and outcome development of research projects. In the same vein, it's also important that culturally and contextually appropriate processes for free, informed consent are implemented for all local involvement, that individuals and organisations involved in the research receive proper credit and attribution, and that communities and local stakeholders have access to research findings in a form that's accessible to them. For many research projects, it can take months or even years to collect data, analyse the results, draw effective conclusions about the research project, and develop strategies for translating this knowledge into local policy and practice. As such, it can take a long time for the contributions and investment of participants and local stakeholders to provide a direct benefit to the community. To address this, AMRRIC operates under the mantra of no survey without service. We strongly believe that all research projects should have timely, direct, and tangible benefits for communities and local stakeholders on the ground. And this should go beyond the potential long-term benefits of the research project itself. These benefits can help to facilitate trust and engagement between researchers and community members, and helps to demonstrate the practical value of research, which in turn encourages continued community support, ownership, and investment in research endeavours. Tangible benefits are driven by the community, but usually include resources or services that help to address the primary issues being researched by the research project. These benefits offer participants an opportunity to gain a better understanding about the focal issue of the research project and/or support the community in addressing these issues. For us, this often includes support for the provision of outreach to sexing programs, provision of parasite preventatives, and incorporating animal management education and knowledge sharing with local stakeholders and animal owners. It can also include provisions to cover the cost of training and employment for local workers to support research activities on the ground. Particularly for investigations relating to disease prevalence, at a minimum, this should include considerations around owner education and provision of treatment and/or preventative medicines for participating animals, thereby providing immediate benefits in working to reduce the risk of infectious disease transmission. The practical impact of One Health research is dependent on the knowledge obtained from research being effectively translated into local policy and practice. Timely and effective knowledge translation involves ensuring that local stakeholders are aware of and have access to research findings in a format they can use and easily understand. The two-way sharing of knowledge between researchers and local stakeholders as part of the community engagement and partnerships throughout the research process is an essential component of knowledge translation, as it ensures that research outputs are reflective of the local context. This includes support for local stakeholders to review and contribute to interpretation and development of publications and other research outputs. Another important component of effective knowledge translation involves using culturally and contextually appropriate strategies to disseminate research findings to the local community. Too often, plans for dissemination of research findings are limited to peer-reviewed publications and conference presentations, targeted towards other researchers, with limited research findings being conveyed to end-stage users. AMRRIC's community education and training programs incorporate the development of culturally and contextually appropriate resources to help make research findings and associated guidelines accessible to local stakeholders and community members. Most of our resources are readily available through our website, and we welcome those involved in animal health and management programs to use these resources where they can to help support community education and awareness around One Health. Bringing this knowledge to communities in an accessible format helps to empower local stakeholders and community members to translate research findings into local practice, inform local decision-making, and helps to increase the likelihood that research findings are incorporated into local policy and practice. Effective knowledge translation is dependent on the community's capacity to conduct research and to implement recommendations from research findings into local policy and practice. In resource-limited environments, this can pose a significant challenge. By helping to build a foundation for local capacity development and help to address existing gaps in skills to conduct and implement research in local communities, researchers can help to ensure that research outputs are translated into meaningful real-world outcomes. AMRRIC strongly believes that all research projects should aim to support and build the capacity of local community through avenues such as mentorship, culturally appropriate training and education, and providing support for local programs to help build a local evidence base and support the existing workforce. Capacity building throughout the research project can help to support local stakeholders by strengthening diagnostic and research skills on the ground. This can include provision of essential equipment and supplies as part of the research budget to support local programs and activities. Local capacity building does not need to be limited to support of technical skill development, though. It can also be used to support broader competencies, for example, by involving local stakeholders in developing and disseminating research findings and supporting community members in the development of resources to help to educate the community about the project's findings. Being approached by researchers can be a bit daunting, but it is important to keep in mind that all research projects need a study population to progress to completion. Through community support and local engagement, research projects have a much greater chance of meaningful translation into local policy and practice, therefore bringing about the best possible outcomes for people, animals, and the environment. Organisations involved in animal health and management activities are both advocates and allies for the communities with which we work. So I encourage all of you to support your communities in navigating collaborative approaches to research participation. By supporting and encouraging respectful and considerate research collaborations, Organisations involved in animal health and management can help to support the best possible outcomes for people, animals, and our local communities. If you'd like more information and resources on AMRRIC's approach to research and how we aim to respectfully approach research collaborations, please feel free to visit our research website, follow the QR link on the slide here, and of course, please do get in touch if you have any questions or comments. We'd love to hear from you.